Have you ever thought, how am I going to handle the pain of labour? Well, you're not alone, and the good news is your breath and your body already hold the tools you need. In this video, I'm going to show you exactly how to work with labour using breath and movement so you feel calmer, more in control and more confident when the big day comes. If you've been following this video series, you know that labour pain isn't something going wrong, it's your body doing something powerful and purposeful. But knowing that isn't always enough. When contractions hit, you need practical ways to cope, and that's what we're focusing on today. How to use your breath and movement to manage labour pain and support your baby's journey through the birth canal. We'll go over why these techniques work, how to practice them now, and how to adapt them through the different stages of labour. Now, we're going to start with breath. So breathing is one of the most underrated tools in labour, but it's incredibly powerful. Controlled breath reduces pain perception, relaxes your body, keeps oxygen flowing to your baby, and gives your mind something to focus on when things get intense. But it does even more than that. Maintaining steady, deep breathing helps reduce lactic acid, which builds up in your birthing muscles. Less lactic acid means less cramping and pain. Breath literally changes your chemistry during labour. And yet, your breath is the first thing to go when you're overwhelmed. So certain moments in labour can really disrupt breath control, like the drive to the hospital, being in a sterile environment or a stressful environment, a sudden shift in pain levels, moments of fear, anger, or even feeling unsupported can make your breath shallow and your mindset spiral. So learning to breathe intentionally, even when things feel out of control, makes all the difference. Now, I want to begin with the grounding breath. So this is your go-to when you're feeling overwhelmed or anxious. Now, what I want you to do is inhale deeply right down into your belly, not your chest. Let your belly rise, then exhale even slower than you inhaled, drawing your abdomen muscles in slightly like you're gently hugging your baby. Now imagine sending that breath all the way down. This type of breath helps release calming hormones and resets your nervous system. So you can use it during early labour, during stressful transitions, or even on the way to the hospital. It's a way of saying, I've got this, to your body. Now I want to move on to contraction breathing. So this is perfect for riding the waves of active labour. This breath is slower, deeper and steady. So I want you to picture the contraction as a wave. Breathe in gently, and as the wave rises, exhale slowly while making a low open vowel sound like oh or ah. These low tones help soften your pelvic floor and keep your body open. High-pitched sounds, on the other hand, they create tension. So the deeper and lower you can breathe and vocalize, the easier your body can open. Now I want to talk about the resting breath. This is the reset between contractions. These moments of rest are golden. Use them. Focus on soft, gentle inhales and even slower exhales. Let your whole body go limp, your jaw, your hands, your shoulders. You can sit, lie down or lean over something. Ask your partner to gently scan your body for tension and remind you to let go. This is a time for you to conserve energy for the next surge. Okay, now let's talk about the transition. So transition breathing is when everything gets a little bit more intense. This is the point in labour where things can feel a bit chaotic. So short, quick, pant, pant, blow breathing helps prevent you from holding your breath and helps manage that rising sensation. It's kind of like blowing out a candle. So controlled, focused and fast. This keeps you from hyperventilating and brings you just enough focus to get through each intense peak. Now, I want you to learn about breathing to resist pushing. So when your body wants to push, but your cervix isn't fully ready. This is important if your care provider asks you to wait. So try taking short, shallow breaths with your mouth in an O shape. Some women I've worked with like repeating the word house with the extra breath behind it, or visualize blowing a tissue off your face. Keep your chin up and let breath move forward. It helps delay that urge just a little longer. Now, breathing while pushing. So this is when I want you to follow your body's lead. When the time is right and you feel the natural urge to push, take a deep breath and exhale while directing that energy downward, which is through your throat, down your body and towards your bottom. Some people like breathing steadily through each contraction, while others like to hold their breath for short bursts just to help guide baby down. Trust what feels right for you in the moment. Now let's talk about movement. Movement is not just a way to pass time in labour. It's a pain reliever, a labour accelerator, and a way to help your baby find the best position for birth. When you lie flat on your back, you're working against gravity. But when you stay upright and mobile, gravity often works with you and labour often moves along more smoothly. Every stage of labour benefits from movement, but different positions work best at different points. In early labour, walking around your house, bouncing on a birth ball, or swaying with your partner can help ease discomfort and get your baby into a really good position. As contractions strengthen, you could try leaning towards a chair or on a birth ball, or get on all fours to relieve back pressure. If your baby's in a back-to-back position, the hands and knees posture can help them rotate. Transition often feels the most intense, and this is when it's tempting to freeze. But staying open helps, so try supported squats or side lying with a peanut ball if you're tired, or you could try kneeling over a ball or over the bed. So these positions keep your pelvis open without exhausting you. And when it's time to push, upright positions like squatting, kneeling, or even side lying can shorten the pushing stage and reduce tearing. You can also push on all fours, which is great for easing baby's head out gently. So we want to put all of this into practice. Now I want you to try this now. So start adding breath and movement into your daily routine. So sit on a birth ball for a few minutes each day and practice grounding breath. Try a few gentle squats or get into a hands and knees position before bed. When you're walking or doing chores, sync your breath with your movement. Make it part of your rhythm now so it's more familiar later. What I want you to remember is your breath and your body are powerful allies in labour. Breath helps calm your nervous system, control pain, and keep your baby well oxygenated. Movement supports your baby's descent. It opens your pelvis and eases pressure. You can work with your body, not against it, to have a smoother, more confident birth. Now in the next video, we'll be talking all about pain relief options, both natural and medical, and how to make informed decisions that align with your birth preferences. You'll learn how epidurals, nitrous oxide and IV pain relief compare to breathing, massage and water therapy, and how to build a plan that works for you. If this video helped you feel more prepared, please give it a like, hit subscribe and drop a comment below. Let me know which breathing technique or movement you're going to try first. I'd love to cheer you on. You've got this, and I'll see you in the next video.